This is CBC Here and Now.
Given the situation and stuff, we've decided to close for an extended period of time.
I'd love to be open and have lots of people, but that's not practical right now, and it's not where the public's confidence is right now.
Restaurants feeling the pressure. Mallard Cottage is closing and laying off staff as others try to navigate the newest wave of COVID.
Record case numbers for days means a strained healthcare system. How union leaders view the province's Omicron response. That's just ahead.
Quiet weather day tomorrow for some, but we've got another warm up on the way. Looks like it's going to bring some more rain to parts of the island.
Welcome to Here and Now. I'm Carolyn Stokes. Well, today a slight drop in daily COVID cases, but now that fewer people in the province are being tested, just how accurate are these numbers? Here and Now's Peter Cowan has been digging into the data and joins us live. So Peter, let's start with those latest numbers.
Yeah, Carolyn, as you said, the numbers are down a little bit, but they're not always going to give us the full picture going ahead of just what the COVID situation is in the province. But let's break them down for you. So there were 493 new cases announced today. The one number that we should be paying attention to, the number in hospital, that's still just one person. There were 164 recoveries, leaving 3,254 active cases. And worth pointing out here that there are actually more active cases right now than there are people who've recovered from COVID all throughout the rest of the pandemic. But let me show you just how quickly our daily case numbers have risen over the last month or so. The one caveat here is now that the province isn't testing symptomatic close contacts of known cases, the daily case numbers aren't always going to be the most accurate indicator. So we're going to have to start looking at other things. So what numbers are important? Well, Dr. Janice Fitzgerald said yesterday that the percent positivity is important. So what percentage of the tests that they're running are positive? That number today is at 12%, meaning more than 1 in every 10 tests they run is positive. And it is a sign that there is quite a bit of disease in the community right now.
We'll also keep an eye on outbreaks where we see them, especially in vulnerable populations. That's always something that we're very closely monitoring. So, I think we will see a shift away from really reporting every single case. And as we've seen in other jurisdictions, we may have to get to a point where we say to people, if you have symptoms, stay home. That's something that we'll have to consider perhaps down the road.
I want to show you just a little bit about how that percent positivity has changed. Early in December, when our case numbers were low, a very few number of people were testing positive. It has peaked as high as almost 20%. So that's 1 in every 5 tests, although those numbers have come down a little bit since then. One of the focuses is going to be on keeping COVID out of healthcare facilities. The Miller Center is now dealing with 5 patients there who've tested positive, as well as a number of staff. Coming up a little later in the show, I'm going to talk to the head of Eastern Health's Infection Control and Prevention about just how they're dealing with that situation and how they're going to move forward with so many positive cases in the community. Reporting live in St. John's, I'm Peter Cowan for Here and Now.
Well, there are more cases of COVID-19 in Sheshatshiu since the Omicron outbreak started. Innu First Nation Chief Eugene Hart says they don't yet know the extent of the spread, as some people are still waiting on test results. Here and Now's Reagan Burden reports.
Steady, steady, steady. That's how Chief Eugene Hart described his schedule since COVID-19 first appeared in Sheshatshiu. As of yesterday evening, when they made an announcement, the community has 14 positive cases.
But we don't know the results yet because everything is backloaded, and some people get them up probably in 7 days, 5 days, 7 days, 8 days. So it's not a fast process.
Hart appeared on the community radio station and Facebook site to discuss COVID-19 in Sheshatshiu. He says they have a security team taking the names of people who are entering and leaving the community and asks that people only leave if they need to. Hart says the security team is seeing vehicles leave with high numbers of people and with children in them. Hart's asking people to leave their children at home and for people who don't reside or work in the community to refrain from entering.
We do get calls if someone's coming in from the community that shouldn't be here, and that's not many, so which is good. But just I was talking to security today, and seems like everything is under control. But I think it's mostly the big part is to stay away from just stay in your own bubble.
A vaccine and booster clinic took place today at the Mani Ashani Community Clinic in Sheheshi, and one is set to take place tomorrow afternoon for anyone aged 5 and older. Reagan Burden, CBC News, Happy Valley Goose Bay.
Meanwhile, residents in Nain in northern Labrador want more communication about the COVID-19 situation in the town. The Nunavut government says there are 15 positive and 3 presumptive positive cases in the community at the moment. Jenny Oliver lives in the town and says she's scared because of the lack of resources and healthcare services available there, and she fears that by the time people realize help is needed in Nain, it'll be too late.
There's little direction in our community except to stay home. There are a lot of vulnerable people here. We have people living in larger households, but there's people who don't have skidoos, people don't have other people who can go to the stores for them. There's a lot of people who are isolating, a lot of people who are lonely. And we all understand the severity of this virus, but members of Nain are waking up with little to no information. The fact that we don't have a large runway and the fact that we don't have lights on our runway, which leaves only good weather and then the daytime for planes to fly. It brings me back to thinking, so what if we have a lot of people who are sick? What if we have bad weather? How is one nurse going to be able to take care of the whole community?
Well, the snowy weather in St. John's today may have played a role in this crash. A St. John's City snowplow collided with a Metro bus. It happened earlier today around Slattery Road near McDonald Drive, and you can see the rear passenger door on the bus was ripped off in that crash. Metro bus says no passengers were on board at the time. They had just recently disembarked, but the driver was on board. Metro bus says the driver was a little shaken up and the bus was towed. An investigation is underway.
Well, Carolyn, roads definitely slick this afternoon and this evening, same thing. But the good news is that snow is starting to move offshore. Let's take a look at what's happening out there. That area of low pressure to the southeast, and it is continuing to pull that snow with it. If we zoom in a little bit, you can see the heaviest snow now is offshore. And as we head through the next couple of hours, we're still looking at these windy conditions continuing, upwards of about 60 kilometers per hour right now, gusting in St. John's area as well as Bonavista. And as we head through the overnight, we're going to continue to see those winds. They'll shift, though, out of the west, but with these cool temperatures, -10 overnight tonight with St. John. So expect the snow and blowing snow to continue. Temperatures across Labrador dipping into the -20s overnight. And if you like some warmer temperatures, that's certainly on the way. I'll get into those details when I come back.
Thanks, Ashley. Well, a fire damaged a building containing 3 businesses in St. John's last night. The fire department was called to Mama Sula's, Peter's Pizza, and Greensleeves on Torbay Road around 12:30 last night. Firefighters were met with heavy smoke when they arrived at the restaurant. They say it took some time to find out where the fire was. They cut holes in the roof for ventilation to let the smoke and heat out of the building. Firefighters believe the fire started in the kitchen. The RNC says its fire investigator was on the scene this morning and is investigating the cause. Well, those businesses were affected by fire, but tonight many other businesses are affected by the new wave of COVID-19. Capacity restrictions because of the Omicron wave of infections is one thing, but as Terry Roberts reports, a general sense of fear and worry is also keeping people away from dine-in restaurants.
Todd Perrin is walking with a little extra weight on his shoulders. That's because the co-owner of Mallard Cottage in St. John's is having a tough day.
I left my desk to come here to do this chat with, half of 25 or 26 ROEs completed, and it'll complete the rest this afternoon, and then my guys will go apply for EI, I guess.
The Mallard Cottage has a national reputation, but this door won't be swinging much for the next 5 or 6 weeks.
Given the situation and stuff, we've decided to close for an extended period of time and kind of wait to see what happens with this Omicron surge and see when we can get back to something like regular business.
Right now, I would say 10, maybe 15% of our business, our normal business.
There's no talk of temporary closures yet at the Merchant Tavern, but the co-owner says things are tough.
We're hoping that we're not going to be in this for too much longer, but it all depends. We really tried our best to try and keep staff on, whether that means pivoting to a takeout format or something else. I'm worried about, it's not just myself, I'm worried about all the people working with us as well.
And how does this restaurant owner feel about the new restrictions, limiting restaurants to 50% capacity?
It's a catch-22. I'd love to be open and have lots of people, but that's not practical right now, and it's not where the public's confidence is right now.
These are restaurant scenes from last fall, at a time when there were low case counts of COVID. Business on the upswing, but the arrival of Omicron has destroyed that sense of optimism and brought with it a return of capacity restrictions and a loss of public appetite for eating at a restaurant.
It doesn't really matter what the rules are. We have to kind of deal with what our customers, how our customers behave, and they just don't feel good coming out to a restaurant in a way that makes it sensible for us to stay open.
So Todd Perrin has been forced to take drastic action.
There's no point being open to lose money, right? And we learned that in spades over the last couple of years, and we just can't afford it.
But he's determined to reopen by Valentine's Day.
I'm highly motivated to keep the thing rolling, and I'll cut myself in pieces to do it.
January is typically a tough month in the restaurant business, and now with the province locked in alert level 4, Todd Perrin tells me that the options for dining in this city have shrunk dramatically, especially among independently owned establishments. The business, he says, is simply not there. Terry Roberts, CBC News, St. John's.
Well, of course, healthcare workers are also feeling the strain brought on by the recent surge in COVID cases. Henrika Wilhelm spoke with 2 union leaders about the concerns of frontline workers.
Thousands of new cases, thousands of tests, thousands of vaccines. A burden carried by healthcare workers in the province, some of whom have been redeployed, moved to more essential areas.
The staff have given up time over Christmas that they were scheduled to be off and volunteering. We've had people come out of retirement to help out. So there's an extreme pressure on our healthcare system right now.
The nurses' union says online school brings added stress for its parents as well as workers in isolation. Over 600 healthcare workers across the province were isolating yesterday, over half of them in the Eastern Health Region.
They're awaiting results of their COVID swabs, and there are delays in that, which we are pushing for to streamline that and to get it done quicker, because that's further impacting the staffing levels in the hospital if we have healthcare workers who are also awaiting their swab results.
In a letter to the provincial government just before Christmas, the nurses' union asked to prioritize healthcare workers when giving out booster shots.
Frontline workers need to be vaccinated in order to protect them and in order to protect the public and the people that we serve. We also have the under 30 age group where it's recommended that they receive Pfizer. And at this point in time, there is no plan that I'm aware of to get this group vaccinated, other than they have to get in line and compete for appointments with the public. It's a resource issue. We acknowledge that. Services and resources are maxed at this point in time. We're relying on retirees. We're relying on frontline members who are volunteering, RNs, LPNs, to go and work in the vaccine clinics, in the swabbing clinics. Nursing students have stepped up and are also involved.
Earl says he understands wanting to prioritize frontline workers, but believes public health is doing the best it can.
I know efforts are being made. I know in some of the healthcare facilities now they have teams set up within the healthcare facilities trying to vaccinate. Some frontline workers have been vaccinated weeks ago, actually. So again, best efforts are being made. I know a lot of groups are lobbying to be first. But again, we got to look at the resources that we have.
Both Coffey and Earl urge the public to be patient with healthcare workers and follow public health guidelines while they are doing their best during this latest COVID surge. Henrika Wilhelm, CBC News, St. John's.
urge the residents just to abide by and follow the public health guidelines.
The Labrador region has the highest rate per capita of infection in the province. In about 8 minutes, I speak with the mayor of Happy Valley Goose Bay about those staggering stats and his own battle with COVID.
Environment Canada has issued a special weather statement for parts of the West Coast. Looks like we're in for some warm temperatures along with some rain. I'll break all that down for you coming up.
During the pandemic, Newfoundland and Labrador has done a pretty good job of keeping COVID-19 out of healthcare facilities. But now, the Miller Centre in St. John's is dealing with 5 patients who've tested positive, as well as several staff. It's in the rehab section of the facility. So, what is Eastern Health doing in order to make sure it doesn't spread and in order to protect other long-term care and health facilities? Well, Dr. Natalie Bridger is in charge of infection prevention and control at Eastern Health. Thanks for joining us.
Thank you for having me, Peter.
So with the Miller Centre specifically, how concerned are you that we've been able to see patients be able to get the disease, and it looks like it has spread within the facility there?
Yeah, and so that is is concerning to me. It's as an infection prevention and control person, this is the type of situation that we've been trying to avoid for the past 2 years, and we've done a pretty good job of avoiding it. But our current foe, the Omicron variant of the SARS-2 coronavirus, has unfortunately gotten into some of our facilities. And in this case, the exposure happened likely on Christmas Day, and by the time we heard about the exposure, I suspect many of the cases of transmission within the unit had already occurred. And that's, I think, what we're seeing on the public health side as well. By the time we're finding out about positive cases, there's been an opportunity for the virus to transmit because it is transmitting so much more easily and quickly.
So we've got this situation at the Miller Center. We've heard about individual cases at other long-term care homes. Are there any others where we're actually seeing more than just maybe 1 or 2 people who have tested positive?
To be honest with you, our spreadsheet is so long and changing so quickly, Peter, that I cannot give you exact details on numbers of cases in other facilities. But I can tell you that pretty much every long-term care facility in Eastern Health has some type of exposure situation going on, either it be with an exposure with a staff person who didn't know they were infected, or maybe a visitor who came in before the visitor restrictions became much stricter, who didn't know they were affected. So we are seeing cases connected to long-term care facilities and personal care homes throughout the region.
We heard this week from Dr. Janice Fitzgerald that it's likely that most people are going to end up getting COVID-19. The strategy has really shifted with Omicron from trying to keep it out of the province to just trying to live with it in the province. Does that change your approach when it comes to places like long-term care homes and healthcare facilities?
Yes, it has changed our approach a little bit because in the beginning of the pandemic, we had, in terms of acute care, we had designated places as being places where people with COVID would go. So you're probably familiar with the Health Sciences Centre in St. John's had a designated COVID unit for South A that was all set up and prepared for COVID patients. And certainly that was the place where people with COVID went. But now with Omicron and with more and more people being infected, it's not going to be possible to keep places, COVID free, if you will. So we just have to do our best to keep our most vulnerable people safe and mitigate risks wherever we can.
How worried are you that we are going to see much larger outbreaks as we see the number of cases rise in the community in general?
I'm worried that we're going to see more outbreaks in long-term care, just because we're just seeing what we're seeing now is a result of what's happened in weeks past. However, I'm hopeful that with all of the public health measures that have been put in place over the past week or so, that we will start seeing a drop in cases all over the region, which hopefully will translate into the healthcare facilities. So I'm hopeful this will be a quick-ish outbreak. But I do think we're going to see more cases in long-term care facilities, and that does concern me.
Dr. Natalie Bridger, I appreciate your time. Thanks for joining me.
Thank you for having me.
This weather update is brought to you by the NL 511 app. Know before you go. Check road conditions, highway cameras, and the Provincial Plow Tracker with the NL 511 app.
Ashley is here now to look at the weather, and it was certainly a day to stay home out of it because it was just nasty driving with the snow coming down and the wind. Yeah, it was a pretty nasty day.
Yeah, it certainly was not nice out. Earlier today, though, with when the wind wasn't so bad, it was actually quite lovely with that snow falling. But temperatures yesterday have been quite chilly. Let's take a look at those across the board. Sitting around -6 for the majority of the day today in St. John. Similar temperature towards Bonavista. Much cooler, though, as you head towards Gander, hovering around -10 as the afternoon high today. And then only reaching the -20s. Labrador City sitting at -22 this afternoon. Now I'll just take a look at the satellite and radar right now. We can see the heaviest snow in those whites has moved offshore as far as the Avalon goes. And as that system continues to track a little bit further north, and further offshore, it's going to pull that snow right along with it. So we're looking at a couple of more hours of some flurries, but with these windy conditions, like I mentioned a little bit earlier, we're likely going to see the blowing and drifting snow continue for a good chunk of the night tonight. And then we're going to see those winds shift more onshore, certainly for the west coast. And it does look like a good chance that snow squalls will develop as we head through the overnight tonight. Certainly for the southwest, we could see some of those squalls even reach the Burin Peninsula and even through parts of central as we get into the early morning hours. But again, those winds are going to stay brisk through the night. Now, just taking a look at the snowfall accumulations, this will take us through to early Thursday morning. You can see some of the higher elevations picking up most of the snow, at least the potential to see the most of the snow. That's in the 30 to 50 centimeter range there. Otherwise, a good 5 to 10 is a good bet for a good chunk of the west coast as we head through Thursday morning. Now, tonight's forecast, looking at those temperatures into the minus double digits. Those wind chills will feel significantly colder, especially up through Labrador. Looking at your temperatures hitting around -29, not a whole lot of weather to talk about, just a few flurries. But when we factor in those wind chills overnight tonight, they're feeling more like the -30s. And even across central Newfoundland, rather, we're looking at temperatures, wind chill values, rather, into the -20s. And then as we get into early morning, Thursday morning, Wednesday morning, you're looking at those wind chills into the -40s for a good chunk of Labrador. Now, we do have a special weather statement in effect for a good chunk of the west coast, even through parts of central and southern Newfoundland. And that's because our next system that's going to move in is going to bring some rain with it. So we'll start as snow for sure. At least the snow squall potential will continue for the west coast in the first half of tomorrow. We may even see a few of those bands reach the Avalon. They'll be likely few and far between, but that risk's certainly still there. And then continuing through a good chunk of the afternoon again for the west coast. And here's the system. So it is going to bring up those temperatures. It's going to be windy as well. But as those temperatures rise, it's going to change over to some rain, and it does look like we could see some heavy rain at times as well as we get into Thursday morning, with those winds ramping up anywhere from 80 to 90 kilometers per hour. Here's a look at the forecast for tomorrow. Quiet, at least for half of the island, with those temperatures around 0 or -3, winds out of the west or southwest between 30 to 50 kilometers per hour. But those temperatures, as you head towards Labrador, still into the -20s. Nain will hover around -20 for the afternoon with lots of sunshine. So I'll get into the rest of the details on Thursday's forecast when I come back.
As the healthcare system grapples with the rising number of COVID-19 cases, people going through fertility treatment are having procedures canceled.
I just feel like we have no choice but to travel out of province to get the care that we need at this time.
We'll talk about the impact on them coming up.
Labrador has seen a surge in cases since the Omicron outbreak. The Labrador-Grenfell region now has the highest per capita COVID rates in the province. Joining me now is Happy Valley Goose Bay Mayor George Andrews, who's actually south of the border right now in Minnesota. So, Mayor Andrews, this is a tough time to be away from your town right now. First of all, how are you doing?
I'm doing well. We should have been home actually today, just about any time now. But unfortunately, the COVID process down here dealt us a hand with both my wife and I testing positive. So we have to delay our return home for a couple of weeks. But we've been actively involved. I've spoken more to I think provincial government, LG health officials, and my council probably more than I've spoken to my family over the last number of weeks. So.
And sorry to hear that you tested positive. How are you feeling? How are your symptoms right now?
Oh, good. Well, actually, I'm almost asymptomatic now at this stage. A little nasally. I'd compare it to a bit of a head cold, but outside of that, no, I'm feeling fine. We're all well versed over the last couple of years of doing things virtually, and we continue to keep updated like that.
And we have updated numbers today, too. There are now 125 new cases in the entire Labrador-Grenfell region today, a total of 624 active cases. And of course, those numbers are for a large geographical swath of the province. But do you have a sense of how many of those cases are in the Happy Valley Goose Bay area?
I guess originally we had the first 3 cases in the province way back when, and those were dealt with, very, very well. Unfortunately, this time we've I guess received the first swath of COVID interaction in our community. So it's a large number of those cases are probably within our community. Some things in numbers. Maybe the numbers coming down, but I would urge, maybe that's because some people aren't being tested or delays in numbers and things like that. Either way, it's having an impact on our community for sure.
We heard yesterday that over 600 healthcare workers are in isolation for the whole province. How concerned are you about the state of healthcare staffing in the Happy Valley Goose Bay area?
Well, from our conversations we've had with the local CEO, they're doing the absolute best they can with what staff they have. They've reprofiled some staff. They've made some mitigating measures at the healthcare and long-term care facilities, both from a protection perspective, but also, I guess, from the perspective of being able to reprofile and use staff in a different fashion. Of course, I'm concerned, just like our community is concerned. Information's important. The long wait lines, the long wait times. The provincial lab, according, I guess, to the briefing yesterday, is working at capacity. So, it's a huge concern. And I mean, at the end of the day, I guess so far we're lucky because hospitalizations are very, very low. So from that perspective, it's concerning that if those hospitalizations go, the people that have to take care of us are our healthcare workers. So that, yes, generally, I'm sure that's a concern in everybody's mind.
And I think it's fair to say the situation in your town right now is the worst it's been so far in this pandemic. What are you hearing from people there? How are people feeling about it? How are they coping with it?
Yeah, originally there was a lot of, confusion, a lot of fear, a lot of looking for information. So from a town perspective, we would share information that would come from, the reliable sources in terms of LG Health or the province. Now that what I'm hearing today is, people are waiting a long time for their test results. Some people haven't been called to be contact traced or advised that they need to be tested. So that's some of the concerns we're hearing now. And again, from some of the businesses, some of the businesses are impacted because their employees are members of our community as well, and their families and stuff. So that's the concerns. We've met with LG Health, and we continue to talk to the province and things like that in terms of just trying to ensure that information gets out in a timely fashion, so that people can make the best decisions and have the best information that they can have for their personal situations.
Well, Mayor George Andrews, thank you so much for speaking with me, and I hope that you make it home soon and safely, and that you feel better soon.
Yeah, and absolutely. And again, just want to send a huge bouquet out to our healthcare workers, and as well, I urge the residents just to abide by and follow the public health guidelines. It's so critical that we'll get over this. It's just that by using those health guidelines, we'll get over probably a little bit quicker.
Thank you.
Thanks a lot.
The healthcare system is grappling to deal with the rising number of COVID-19 cases in the province. It's cancelling anything that it doesn't consider emergency or urgent as it tries to free up staff in order to do things like booster shots as well as test for COVID-19. That's having an impact on a lot of people who've been waiting for all sorts of procedures. Stephanie Regular is doing fertility treatments and she's had them cancelled. Stephanie, thanks for joining me.
Thank you so much, Peter. Thanks for the opportunity to be able to share our story.
So what was your reaction when you found out that you wouldn't be able to go ahead with some of the procedures that you need?
Just yesterday, actually, I did call the fertility clinic here in St. John's asking about proceeding with an IUI treatment, which is artificial insemination, and I was told that those aren't happening right now, at least not for me. I mean, I can't speak to everyone else, but a lot of people that I have chatted with have said that they've been told that such procedures are on hold right now because a lot of the staff from the fertility clinic, the only fertility clinic in the province, a lot of their staff are being deployed to help out with the current COVID-19 situation.
What impact does that have on you?
That has a really big impact on me. Mentally, first of all, I mean, this has been a really long struggle for us. It took us 20 months initially to even be seen by the fertility clinic, and I know that's of no fault of their own. The staff and the doctors and the admin staff at the fertility clinic are excellent, and they've been truly wonderful to us, but there's just a really high demand for such resources. And, waiting and waiting, it really does have a big impact on us. So by not being able to continue and have this artificial insemination procedure this month and maybe even next month, it just, pushes our journey along even further. Currently, we're on the list to do in vitro fertilization, which is IVF, out of province in Halifax later this year. And that can cost couples anywhere between, $25,000, $30,000. There's no coverage from our province, one of the only provinces in the country that doesn't offer any coverage. Of course, it's not even offered in the province, so we have to travel and relocate to a different province for a period of time. So by not being able to truly, fully exhaust all of our options here, I just feel like we have no choice but to travel out of province to get the care that we need at this time.
What about the argument, though, that the staff are needed to deal with more urgent things? For example, making sure people get tested for COVID-19 or getting booster shots to try and deal with this pandemic?
I totally understand, that the COVID-19 situation in the province right now is less than ideal, but it's not new for us either. So I would really, I just expect better at this point in time. I would expect that that there would be protocols in place. These are very time sensitive and important appointments for a lot of different people, hundreds and thousands in the province. And, finding out that we're not considered emergent or important enough to proceed at this time with something that's very important to us is just not good enough. It's heartbreaking.
Well, thank you very much for joining me and sharing your situation.
Thank you so much.
Well, the City of St. John's is pushing to make recycling mandatory by requiring residents to use clear, colorless garbage bags. Starting this week, residents must use clear bags for their trash, but are permitted one black privacy bag. So to get some clarity on this new policy, Councillor Sandy Hickman joins us. So, Councillor, can you begin by explaining the idea behind this change? What's the reason for these clear bags?
Oh, Carolyn, yes, this is the next step in recycling. What we're doing here now is going from voluntary to mandatory recycling as of January 1st. So one of the ways that other cities across Canada have used to monitor and to enforce and keep an eye on things is through using clear bags where it's easily identifiable if there are recyclables, mistakenly thrown into those bags. Sometimes people just aren't quite aware of every type of piece that can go in to a recycling bag, and they're not sure, they throw it in the garbage. So with spot checks and with cameras in the trucks, we can now do some monitoring of that.
And what happens when the garbage collectors see something in the clear bags that should be recycled?
Well, we will, first of all, be allowing a grace period for that, for people to change their habits or continue their good habits, which most people have, and to change from the opaque green bags usually to the clear bags. We understand there's a bit of a supply issue right now, and we will certainly allow a little bit of time for people, many weeks, that will be, I'm sure it'll be more than a few weeks, for people to adjust and to get into the clear bags. The reinforcement will not be severe at this point by any means, but later on it would be tags, stickers on your garbage, and it would be left behind. That could be many months down the road. Whenever we're going to do that, we will wait and let everyone know well in advance that enforcement is getting stricter.
And can you talk about the purpose of allowing one black bag?
Yes, well, if needed, if any homeowner needs to use a privacy bag, we call it, which will be opaque, we are recommending kitchen catcher size. That could be used for whatever needs that they might have that are personal, that they don't really want people to see in their garbage, and place it inside the clear bag. That's quite allowable, and that's just a privacy bag.
Can you talk about how successful the recycling program has been overall in St. John's? Do most people tend to recycle? How do we measure up?
Actually, again, through audits over the last number of years, we found that up to about 75% of the people in the city undertake on a fairly regular basis, whether that be once a month or once every 2 months. And many people do it every collection, of course. But there is still not 100% understanding of each individual item that can go into the recycling streams, because we found that there are some cross-contaminations, mostly recyclable containers and some recyclable paper in the garbage, but a little bit of yard waste. And we are concerned about hazardous waste. We want to emphasize hazardous waste has to go to direct to Robin Hood Bay on Wednesdays and Saturdays. As time goes on, people have become much more aware of the importance of recycling to the environment and also to the life cycle of Robin Hood Bay landfill as well. If we can extend the life of that, then that saves taxpayers millions and millions of dollars in closeout and starting up a new site. So we're hoping that's going to be many decades out before that happens.
All right. Well, Councillor Sandy Hickman, thank you so much for explaining all of this for us.
Thank you, Carolyn.
Ottawa and Indigenous leaders have announced a $40 billion agreement, which includes compensation for First Nations children removed from their homes.
I'm very pleased to announce that Canada and the parties have reached two significant agreements in principle. One that provides fair and equitable compensation to First Nations children and families harmed by discriminatory underfunding, and the other addressing the long-term reform that's needed for the First Nations Child and Family Services Program.
The deal earmarks $20 billion in compensation for First Nations children removed between April 1991 and March 2022 while living on reserve and in the Yukon. Current and former federal governments spent millions fighting the challenge before announcing the deal. Parties have until the end of March to finalize the agreement, though the Canadian Human Rights Tribunal and federal court still have to sign off on it. Well, in many cases, it is still up to the individual to prove their case. That's what happened to a Mi'kmaq woman from Nova Scotia who was stolen from her family not once, but twice. She was rejected in her bid for compensation, so she chased down the proof herself and went all the way to the United States to do it. Freelance journalist Trina Roach has her story.
Debbie Paul visits the site where the Shubenacadie Residential School once stood. When it closed in 1967, she was the last Mi'kmaq student to leave. Paul is 12 years old in this photo, unaware her life was about to take an incredible turn.
They took me. They took me without permission. They crossed the border.
A nun with the Sisters of Charity Halifax took Paul to the States without consent and abandoned her with the nun's brother and family.
What would you call, what she did in terms of taking you and putting you on a plane and bringing you to Rockland, what do you call it?
Theft. Theft.
Paul went from the residential school to the 60 Scoop, a practice of removing Indigenous kids from their families, communities, and cultures and putting them in foster care or up for adoption. She filed for compensation under the settlement agreement with Canada.
I think I deserve it to live the end of my life because I went through hell.
But neither the Canadian government nor the Sisters of Charity have any record of what happened. Paul's compensation claim was rejected.
Please send us more information on the length of time and location of your placement. I did that, and I have no proof. None. No records. They have no records.
She appealed, but now needs proof, and she can't find it in Canada.
But today, I feel good. Going there to get my records.
Paul chases a paper trail all the way to Rockland, Massachusetts. Months ago, she called looking for her elementary school records here without luck. But when a CBC Investigates team got involved, an administrator dug through old boxes in their vault.
Oh my God, I got my school records.
Let's see.
Finally, proof. She was under the guardianship of the nun's brother and his wife.
This proves everything. This little piece of paper. Wow. I matter. I matter.
Paul arrives back home in Mi'kma'ki. She hopes her school records are enough for compensation as a 60 Scoop survivor. But she says the onus shouldn't be on her to chase down records.
Reconciliation doesn't start with me. Reconciliation starts with you. You open those books. You open that material.
Nearly 8,000 claims are currently being assessed. Almost half require more information. Paul hopes her story helps others.
I'm here today. I matter. This is what happened to me. And you know what? You matter. You as an individual, you matter.
For CBC News, I'm Trina Roach in Ukjibuktuk, also known as Halifax.
And support is available for anyone affected by residential schools. You can access a 24-hour crisis line by calling the number there on your screen, 1-866-925-4419.
Tomorrow looks fairly quiet weather-wise for a good chunk of the island. We are looking at the potential for some snow squalls to continue for the west coast. And then as we head through the evening hours on Wednesday, continuing into Thursday, that's when we're going to see some rain. Let's take a look at the future tracker to get us there. As we head through the overnight hours, that's when we're really going to start to see those temperatures warm up and then that rain move in for at least the west coast, south coast, and central. Northern Peninsula looks like you're going to stay in that snow for a little while longer. But as that area of low pressure, depending on the track, you may even see some freezing rain for a little bit for the Northern Peninsula. So definitely going to keep an eye on that one for Thursday afternoon. Temperatures will definitely be warm. It does look like some windy conditions as well as we see those winds out of the south for central and eastern Newfoundland. But the heaviest rain looks like it should fall through central now, or rather the south and central. So temperatures are sitting in the single digits, 5 to 9 degrees through the day. You can see the Northern Peninsula at this point keeping your temperatures a little bit cooler, around -4. But if that track is a little bit further north, you may get into that rain and or freezing rain. And then Labrador, cold side of this, going to still keep that potential for some flurries in for Happy Valley Goose Bay, but overall sitting around -23 for Lab City through the day and -19 for Happy Valley Goose Bay. Now, as far as rainfall amounts, this is just an early indicator. About 20 to 30 millimeters is certainly possible. Now, exactly where that falls is what we have to figure out at this point, but most of the island will see somewhere between 10 to 20 millimeters. So all that snow that fell today, especially on the Avalon, will likely be gone by Saturday morning. Here's your temperatures on Friday. They're going to dip right back down, down to the minus single digits. So everything that does fall will change back over to the potential for a few flurries in the afternoon and some peaks of sun as well, eventually clearing skies. And then for Labrador, you're going to stay again pretty chilly, -18 for Nain, -13 for Cartwright, under a mix of sun and cloud as your afternoon. Now, as far as the forecast goes over the next couple of days, like I said, windy conditions on Thursday. By the time Saturday rolls around, another warm up for this point, eastern Newfoundland. Temperatures up again around 8 degrees with those windy conditions, and then looking at Sunday, back down below zero, -6 will be the afternoon high. Now for central and western Newfoundland, keeping you on the cold side by Saturday, this does look like we'll see some snow, could be significant, keeping an eye on that one. And then for Labrador, you're looking at your temperatures staying well below the freezing mark into the minus teens again through the weekend. By Sunday, that's when we'll see that snow. I wanted to share this photo, sunset in Wooddale. Mark shared this great shot with us. Thank you so much for that. If you have any weather photos, send them to nlphotos@cbc.ca.
Oh, that is beautiful. Thank you so much, Ashley. Well, a little earlier in the show, I spoke with the City of St. John's about those new clear bags. Well, the city just put out a release saying it's delaying many of its recreational programs for adults, seniors, and for children. You can find out some more information by contacting the City of St. John's on that. But some good news, though. The Loop will remain open with a reduced capacity. Well, that's it for Here and Now this evening. Thank you so much for spending part of your evening with us. Hope to see you again tomorrow.